Hi, everybody. Welcome to January 6, 2021 COVID Task Force meeting, the first one of the new year. I'd like to thank everybody for participating. I would like to remind everybody that Lori is helping us interpret today, and we want to talk slower so that she is able to translate for those that have trouble hearing us. So please talk a little slower. The material we go over today is important, and we want all Hammond residents to have access to it. So like we do for every COVID task force meeting, I start off with our medical report. We usually start off with Dr. Frank Masana of Comprehensive Care. Nice to see you, Dr. Frank.
Good to see you. Happy New Year.
Happy New Year to you too. Could you go ahead and give us a report on where we stand today in regards to COVID and what's really changed since the last time we spoke?
So not a lot has actually changed, but there's been a lot in the media, and I'll explain what I mean by that. So there's been a lot of talk about different variants that have been showing up. And when I say that hasn't changed, there's a lot of probably different variants that we don't even know about that are out there. It's not a surprise to hear about this other variant that they first identified in Great Britain. I guarantee you it's in every state in our country already. So we hear about it and it causes a lot of concern and a lot of alarm, understandably, but it's not surprising from a medical standpoint. Viruses mutate, and there's other mutations that we just don't even know about because we haven't really been looking for them. Well, I shouldn't say that. There are certain agencies and departments that are looking for them, and I've identified them. To this point, it does not appear that even though this new strain seems to be a little more contagious, it's not any more virulent, meaning it doesn't cause any more level of sickness. It doesn't cause any greater mortality. In fact, it may cause a little bit less. We don't really know. And unfortunately, with this whole pandemic, we're kind of learning on the go. So we're getting a chance to see what historically we've only read about in books, especially from a medical standpoint. The last time we had a pandemic was, 100 years ago. And so I remember reading about it and learning about all this in medical school, but we've never actually had to live through something like this and see it in action. So there's a lot that we don't know that will be coming to light going forward. But the bottom line is that the vaccine is being rolled out, and I forget how many millions of people have already gotten it, but less than we had hoped by the end of the year. But it is starting. I believe there will be a couple other vaccines that will be applying for emergency use authorization potentially this month or maybe early February, which will put even more supply into the pipeline. And some of those, I don't know enough about the technology on all of those to tell you, but I know some of them do not require the same storage requirements, so they'll be easier to distribute. We will have a point where people will be able to go to Walgreens, CVS, their local doctor, and get immunized. But I suspect we're still, several months, probably not until summer before we start seeing that really widely happen. So,
Dr. Frank, let me ask you a question. With the new strain, and obviously the COVID vaccine from Moderna and from Pfizer, are we worried do we know that the vaccines can also handle the new strain, or is the new strain resistant to the vaccines that we're all counting on?
So it's a great question. The short answer is we do not know for sure. However, Pfizer and Moderna, and I think Johnson & Johnson have all come out and said they are 100% confident that the vaccine will cover these new strains. There's mutations are not significant enough. Now, that being said, there is the possibility that this could continue to mutate, and over time, we may not, the vaccines we receive today may not cover in the future. And there is always that possibility that we may have to get updated immunizations for a different version or variant. But I don't
have COVID shots every year, sort of like we have flu shots. I mean,
it's a possibility. I would be surprised if it got to that level, simply because the flu virus is much more of an unstable virus, and it mutates very rapidly. COVID to this point has not been doing that. There are mutations. There's always mutations to every virus, but not at a rapid enough rate that I would expect to get it to that point. But we really don't know the answer to that question.
Wow. So that would be real bad news if we found out that the new strain was resistant to the COVID, vaccine. That would be horrible news, obviously, right?
It would be catastrophic, truthfully, because I think everybody's holding on to the hope of getting back to normalcy with this vaccine. And, sometime this year, everybody's, I think, in the back of their mind, thinking that we will have some, semblance of our normal, life prior to all this. I still believe that is going to be the case, from what I know, and what I've been reading. But, this is live action. Things could change next week, for all we know.
You got the vaccine already, right, Doc?
I got my first dose, and I actually get my second dose today.
Congrats.
Yeah, thank you. We'll see. I had no side effects on the first one, so we'll see. The second one is where they say you're supposed to get
really?
ones.
Oh, yeah. What happens if an interesting question came to me today and they wanted me to ask it on here. What happens if you get the first dose and then you're like a snowbird? You get your first dose in the region and then you go off to Florida or you go off to Arizona where you live for the rest of the year. Can you get separate doses or do you have to fly home to get the second dose?
So the answer is you could get the second dose anywhere as long as it's by the same manufacturer. Some of these are single dose, some of the newer ones that have not been approved. So we will have a single dose option. I believe that's Johnson & Johnson. The only issue you may have is that vaccine rollouts are all being done by the state and local health departments. So the CDC has put out guidelines. Not every state is following them to the T. Most of them are following them in the spirit of it. But you may find, like you said, if you're a snowbird and you go to another state that has different rollout protocols, you may not be eligible for the vaccine. And so you probably would want to look into that before you leave, especially if you really are a snowbird and you're going to be gone for several months. It would be better to initiate it in the same place you're going to be receiving the second dose.
Gotcha.
But I know for sure that has happened. I know of a situation where somebody actually got one in Puerto Rico because they were going to medical school there. And they thought they were going to have to go back to Puerto Rico to get the second dose. But they were able to get it here locally. They just contacted the local health department and they were able to show that they had the first one. And so it wasn't a problem. But again, that's up to the state and local health departments.
Thanks, Frank. It's good to see you.
Likewise.
Thanks, Dr. Frank. Dr. Frank's been with us all the way through the pandemic, just like my next guest that I'm introducing, Karen Callahan, who works for Franciscan Health Care Centers in Hammond. How you doing, Karen?
Good. Happy New Year to you, Mayor. Happy New Year, Hammond. I wish everyone health and happiness for 2021.
Thank you. Like you're in a very warm place. Right? You in front of a fireplace?
Yes. I'm working remote today.
Hey, let me ask you a question before we get started. Same question I asked Dr. Frank. I know that you guys are probably more on the front lines than Dr. Frank, as far as I know. He primarily focuses on occupational injuries and occupational health, whereas you at the hospital, you probably see a lot more vaccinations taking place, if I had to imagine correctly. I know, Dr. Frank, you're not offering that at CompCare, right? You can't get vaccinated there.
Sorry, to unmute. No, we cannot. No, it's only being done at hospitals at this point.
Thank you. So Karen, and you guys are vaccinated at Franciscan Health in Hammond, correct?
Correct.
So in a situation like the one I brought up earlier, let's say you're home for the holidays and you get a shot and you get the 2-part shot, and the first shot you get right here in Northwest Indiana, and then you fly home to Florida or you fly home to Arizona. Should they fly back to get the second dose, or do you think they could work it out locally?
No, my opinion, I would say 21 days is worth staying for that second immunization. And it's exactly what Dr. Manasana said. If for some reason the next State Department puts you at the bottom of a list, you want to stay on track with how you're supposed to get the vaccine. And this is pretty important. I would probably stay home for 21 days until I got the second shot. that would be my suggestion, but people are going to do what they want to do.
I'll let my father know. He's the hypothetical I brought up, so.
He's not going to be happy, but so speaking of the vaccine, the hospital is the second round is started of the same like Dr. Masana. No adverse reactions as of yet to be noted or documented. So that's a good thing.
So you had your shot already also, right, Karen?
Pardon me?
You had your shot already?
Yes. Yep. I get my next one Monday. Monday is my second one.
Congrats.
And you will receive an email from the states or notification from the states when it's your turn. But healthcare workers are priority, and I think the second round may be teachers and people to get the kids back in school. So
is it important if you're getting the second shot? Is it important it's at 21 days exactly, or is it like you go 35 days and get the second shot, or is it really important to stay on schedule like that?
So when you go to get your vaccine, they will calculate when the next one is. You get a little card, and it's documented on the card, and then you come back that day. There's already an appointment, and people are ready for you.
I could add a slight bit to that. So as Karen was saying, 21 days is the Pfizer, actually 30 days for Moderna.
Oh, I'm sorry.
That's okay. But we did have a situation someone wasn't going to be able to, they thought they were going to get the Pfizer. So they went in, they ran out of the Pfizer. So they had to get the Moderna. They were going to be out of town that following week, which would have been the 30th day. So they actually called the manufacturer. This was at Community, and the manufacturer said, "We have no data, to tell you if it's okay to go, how far beyond." But what they will say, and they do say, is you cannot get it any sooner than the recommended. And this goes with most immunizations. There's a time after, there's a minimum time. You can't go before that, but you probably have a couple of weeks beyond that. But they will not be able to actually say that. So you really want to try to stay on the program. And what Karen said is absolutely true. It's all being done through the Indiana Department of Health in Indiana. And when you go in, you actually register through the U.S. Health and Human Services. And that goes through the state of Indiana. And I've been getting email or text reminders letting me know. And I had to schedule my vaccine, the second dose, the day that I was there for the first dose.
Right.
And I've been getting reminders like constantly, because it's real important that you get that second dose.
Okay.
And it's very organized. Yes, it really is. They did a really good job. You can even register on your phone if you have to. And it's really important probably to pre-register, just letting the citizens know when it's ready, because when you pre-register, when you get to the point of where at the hospital, whatever hospital you're going to, it helps move the line, because a lot of nurses are volunteering to give the vaccines. So it's really important to pre-register, just to let people know.
And what pre-registering is just answering a few health questions, giving your name, your date of birth. That's really about all it is. And your health insurance information. So it's really, really simple. I did it on my phone.
Right.
Really, really simple. And like Karen said, it really helps expedite and speed the line. And these hospitals put a lot of time and effort into planning the vaccination program that they have. And I was very impressed with how efficient and well run it was and is. So I agree with Karen. Pre-register will absolutely make it go a lot more efficient when you get there.
Yes, agreed. Just to add a little bit to what Dr. Asano was saying about the other strain, those things that we have been, everybody knows, masking, social distancing, washing your hands, staying with your pod. That's so important, even more so now because of the second strain, but it's really important to do that. And, we all have to, like Dr. Masana said, is be hopeful that this is not, because we do want to all get to normalcy. But until that time, we need to make sure that we're doing that. And that's to help hospitals. As of right now, in the hospital, there's 20 positive, 7 rule outs. To date, 930 discharged home, 96 deceased. The ICU is not full. We have 4 in the ICU that are COVID positive and 1 is vented. And just a little bit of information out of Wuhan, some of the research that we've been doing, or that they've been doing, is those comorbidities. So those people that have obesity, cardiovascular disease, hypertension, diabetes. It's really important to, at this time, really ramp up that immune system. They also found that the vitamin D deficiency, I'm sorry, Lori, I'm talking too fast. The vitamin D deficiency and actually lack of fiber is another thing that's come out of the Wuhan research. So when I really tell people to, decrease their stress, get enough sleep, all those things, physical exercise, eat right, they're so important in this time, always, but definitely while this pandemic is going on.
What about trending? Is it trending upward, trending downward as far as admissions and, ICU and COVID positive? Do you see it getting worse or getting better?
I think we're right now at another plateau. We're at another plateau. We had a couple different trends, right? March was a spike. It went down in the summer and it's going back up. But right now it's kind of plateaued. So we'll see. Let's see. New Year's Eve was another holiday. So 14 days usually, maybe we'll see by the next COVID task force meeting, it'll be trending up again. Hopefully not, but right now we're at a plateau.
Okay. I appreciate you. And I appreciate Dr. Frank very much for giving us expert advice. And so as far as testing, how do people, what's going on with that right now as far as the vaccinations I'm at? So, I haven't been vaccinated yet and I'm waiting my turn patiently, obviously. Do you know who's getting vaccinated now? Because I know my father did, and my father's, 70 plus years old. So he was chosen, thankfully. I'm happy for him. Where are we at in that? Do we just show up to the hospital and say, hey, I want to get vaccinated?
No, it's not driven by the hospital. It's by the Indiana State Department of Health. So what they're mainly doing now are healthcare workers, EMS, and age 65 and older. So that's where your dad's category is. I don't know. Maybe Dr. Masana knows. I don't know exactly where they're at in the next transition, but I know that you get informed by the state, not by the hospitals. Okay.
All right. Does anybody else have any questions for Dr. Frank or Karen before we move on to the next segment? Yeah, full gallery. So just raise your hand or do whatever you do on Zoom. Anybody? All right. Thank you very much for the medical experts and their help. Next, I'd like to go to Kevin Smith, Hammond's corporate counsel. How you doing, Kev?
Good morning, Mayor. How are you?
Good. Could you give us an update as far as where we stand and as related to the governor and our declaration of being in a red zone and what that means overall in the city of Hammond?
Sure, Mayor. So what the governor did this week, most recently, actually it was end of last week, I think it was around the 31st of December, and then he also issued an order, 2 orders on the 31st of December, 2052 and 2053. He renewed the public health emergency through January 30th of 2021, which means that all those other issues that we've talked about before, like being able to have public meetings via Zoom and things like that, are all allowed through January 30th, 2021. He's been very consistent in renewing that on a 30-day running basis. So unless we see any real changes, I don't think that that's going to move at all, and he'll probably have to renew it again at the end of January. The other thing he did was he extended, and this is in order 2053, his most recent one. He extended Executive Order 2050, which was his last real detailed order about businesses and things of that nature. He extended that through January 24th, 2021. So that went into effect as of January 4th. He extended it for an additional 3 weeks. And I'll get into that in just a second on what that means. and just review what 20-50 did. But I did want to note that only one county in Indiana is yellow, 45 are red, including us, and the rest are orange. So what 20-50 is, just a reminder, is that it allowed all businesses to be open, but it also set restrictions that people needed to be seated. If you're not seated, you have to wear a face covering while you're up, that places of business are supposed to have a COVID response plan in place that allows for social distancing. So at restaurants, tables should be 6 feet apart. There's no percentage restrictions. There's no restriction that says you have to be only 25% open or 50% open, but you do have to institute social distancing, including tables, seats at the bar, things of that nature. So that does in fact limit, but it's based on not a percentage, it's based on your square footage and what space you can allow. It also, and everybody's seen this, there's mask signs on doors mandating masks when they come in public spaces and public and private businesses. So we've all seen those and I think are getting used to them. The only thing I did notice that, and this is probably something that Karen and Frank have noticed, Dr. Frank have noticed, and that is that the governor did release the prohibition on non-essential surgeries and things if hospitals have the space to allow that. So other than that, 20-50 is still in effect. The only thing I would say, Mayor, that I don't know is what impact the Lake County Health Officer's previous order, which is 20-02, has had based on these subsequent state orders, because I don't believe the county has issued any further orders, further restricting, because local official can order more restrictive matters, but I haven't seen that from the county.
Okay, thanks, Kevin.
Thank you, Mayor.
Next, I'd like to go off to Phil Talon, Hammond Chief of Staff. How you doing, Phil?
Good morning, Mayor. Doing well. Thank you. Happy New Year to everybody also. You know, from a city perspective, Mayor, we're doing pretty well as far as, you know, the city employees that have tested positive from time to time. They've all been gone through the normal protocol of taking the couple weeks off essentially and everybody's come back to work safe and healthy, which is positive for us. Unfortunately, I saw in the 5-county Northwest Indiana area, Lake, Porter, LaPorte, Jasper, Newton, we just hit 1,000 deaths, which is essentially almost 1/8 of all of Indiana, because Indiana's at 8,300 deaths since COVID started. But I do have a question for Karen, which is there was a recent USA Today article that came out, and it was talking about the CDC and how they have said that Indiana so far has only had 27% or they've only used 27% of the vaccinations that they've been issued, essentially saying that we're behind in getting people vaccinated. Do you have any information on that as far as working for the hospital or knowing why that's the case, why Indiana would be behind?
You know, I don't have the answer to that question, but I would question that because the rollout has been, like Dr. Masana and I have said, has been fantastic. There's appointments consistently. You know, it's not mandated. People don't have to get the vaccine, but you know, appointments are filled. People are getting them. So I'm not really sure. I don't have an answer to that. And, you know, maybe USA Today, I would question the validity of that. Do you agree, Dr. Masana, or not?
Oh, you know, there's so much speculation about so many different things through this whole pandemic.
Yeah.
I can tell you, I'm looking at the Indiana Department of Health, and so far 75,842 first doses have been administered through the 29th of December, which is actually pretty darn good considering
a lot of doses.
It's only a few weeks. I imagine that number is significantly higher, and that will be something that goes up higher. I suspect that just like anything, they planned very, very well, but when you're doing something this fast, you can't account for every variable. And there are, I'm sure, are some variables on, you know, local or state levels that just weren't accounted for that may be slowing some of the distribution or the immunization program itself. But on the whole, I honestly agree with Karen. I think they've done a fantastic job, and it is proceeding rather well.
Well, okay, we'll just keep an eye on that, I guess. Somebody did have a question. They asked where you pre-register to get the shot.
Go ahead, Garrett.
I was going to say there's a notification from the state of Indiana. There's not a pre-register. That's how we've gotten it at the hospital. Nurses have gotten a notification. So kind of like Mayor Tom said, you're kind of have to patiently wait until you get notified.
Yeah. They, on the Indiana Department of Web, indiana.gov at coronavirus.in.gov/vaccine, they have information regarding the vaccine program, who's eligible, and how they're proceeding right now. It's being restricted to healthcare workers that have direct contact with patients. And then they just kind of say that the additional phase is yet to be determined.
Right.
So they have not released the full plan yet. And unfortunately, it's kind of a waiting game at this point.
Let me bring in Kevin Margraff, Hammond's deputy fire chief, he also received this shot, and about how this came about. And he's with me right now, so Kevin.
Good morning, everybody. And speaking to Dr. Frank and to Karen, I was notified as a frontline EMS worker via the Board of Health in the state of Indiana. And the text that I received had specific instructions not to share this link with anyone else, which I attempted to do, quite frankly, and until I read the fine print. And so I didn't do that. It was only specific to me and me alone. But everything else that Dr. Frank and Karen had spoken to in regards to registering, once you get that notification and text message from the Board of Health or the state, it was really quite simple at that point. I've already had my first vaccination. I'm getting my second one on Friday. And from that end, it's quite simple, but that is the protocol that the state's utilizing.
I suspect at this point right now, they're contacting people that are licensed healthcare providers in the state, because we're all on record as being licensed in the state. So they have our contact information already.
Yes.
So they're only notifying those individuals at this point. And like you said, it was very clear, and you have to testify that you are a healthcare worker actively seeing patients. I got something stating from the Indiana Department of Health stating that if you're retired and you've received this, you're not eligible if you're no longer seeing patients. So they're going to eventually get through that pool of people, and not everybody's registered with the state of Indiana for whatever businesses that or careers that they're in. So they'll have to come up with a different system,
right,
of notifying, but they don't have that released yet.
Thank you, Mayor.
Thank you. Mayors haven't gotten any notification from the state yet, for the record. So, and I get sneezed on for a living, so I don't know. I don't understand. Phil, you got anything else you want to cover?
Just, Mayor, that the renovations we've been doing at City Hall to make our building here safer, to allow for more social distancing. We're at the tail end of that, so we're almost done. And obviously that protects our employees a little better, and in turn protects residents that come to City Hall that have to do, things that, getting permits and licenses and things of that nature. So that's coming to an end, which is going to be great for Hammond and obviously the employees and residents that use this building.
Okay, thanks, Chief of Staff Bill Talon. Next, I'd like to go to the School City Hammond. I'm not sure if I see Superintendent Scott online. Are you out there, Scott? Doesn't appear so. I know reading the paper this morning, I'll give the superintendent's real quick abbreviated. What I learned this morning by reading the newspaper was the School City Hammond decided to extend e-learning into February. I don't remember the exact day because I thought Scott would be with us this morning, but they extended e-learning for at least another month in School City Hammond. School City Hammond hasn't had one day in class since the pandemic started. The kids went home in March and they haven't been back to the schools since then. And I think the school city of Hammond's handled this very well. And superintendent's not here to give a report, but I did read that this morning. Obviously, we'll double up and make sure we get Scott back on in 2 weeks when we have our next COVID task force meeting. Yeah, sure. I got Tiffany from Hammond's IT department stepping over here. Come on in.
Good morning. I received an email from the school city of Hammond this morning. I have an 8th grader. They are planning to possibly reopen February 16th. Parents are given the option to do e-learning or allow their children back in the classroom if they feel it's safe. Thank you.
Thanks, Jim. That's your report from the school city of Hammond. Hey, I see Jim Talon, the head of the Hammond Parks Department. Could you unmute, Jim?
Yep, I'm here, Mayor.
How you doing?
I'm good. How are you?
Good. I know that you and I are constantly getting calls of concern about the parking lot, the sportsplex, and the fact that we're still operating. Could you tell me how that's legal? We both know it's legal. Can you explain to everybody what protocols we have to do to be able to keep the sportsplex and other centers open like that?
Right, absolutely. As Kevin Smith said earlier too, that the executive order that was in place in December was carried over right now. We were allowed to have tournaments in our facilities with specific regulations. One of them being that if you were a youth, you were only allowed to have one parent come with you. Obviously in the sportsplex, the masks are still mandated. Social distancing is still in place. We're still cleaning, doing those kind of things. So it's still a carryover from basically what we had going on before. So we are limiting. I know that when you see the parking lot, you'll see a lot of cars in there, but people have to remember it's a very big building, 135,000 square feet. And you and I know, have both walked in there while some of these things are going on, and you can see maybe one person or two people in a corridor. So it's spread out. Even I know on the soccer side, some additional safety measures they've taken is they've implemented a wristband. You get a colored wristband when you come in. So say you have a green wristband, that you are allowed to be in the facility for a certain time period. So say at 10 o'clock, if you're wearing a green wristband, they know that you're not supposed to be in there. So our staff can actually go in, find you, and let you know that your window's over at that point. So there are some of those things that we're taking additionally in place. But yes, we're following the executive order. And I know it looks busy sometimes. I know that we've seen people have posted a picture of a line of people trying to get in, and that is specifically, we're checking them in, making sure it's only one parent coming in with a person, and that is usually in a transition time when some games are ending, some people are leaving, the next group of people are coming in to keep the numbers down.
The line is a necessary evil so that we can stay open, really. I mean, we have to totally control who comes in and who leaves, and if we didn't have a line and we just allowed everybody unfettered access to the sportsplex, there's no way we could comply with the orders that were handed down to us by the Lake County Health Department.
Correct. So it's just an additional measure that we're taking to make sure we're staying within the guidelines.
Okay. Kevin Smith, you out there?
Yep.
You got anything to add to that?
I do. I did a little checking, and I misstated something earlier. Porter and LaPorte County are in red. Lake County is in orange currently. It's right on the verge. So, but that doesn't change anything from the perspective of the governor's order. But I did want to mention, and thanks to Jim Talon for helping me point that out, that we are in orange now.
Okay. I was talking about sportsplex and things like that. Do you have anything else?
Yeah, I just wanted to follow up that before I forgot. But regarding the sportsplex, I think what Jim said is absolutely accurate, and I think he's done a great job, and his staff have done a great job. And Mayor, with your leadership, we've been able to allow those things to go on, albeit with a very strict plan that was approved by the county prior to it, prior to us going into that executive order by the governor. And I think the Parks Department has done a great job, their staff, Kim, Jim, and others, to make sure that's implemented, and they're keeping to it. And I think parents are starting to get the feel for it, and that's a good thing.
Hey, Phil, could you do me a favor on mute real quick? Our next
Yes, sir.
our next COVID task force meeting is going to be in 2 weeks. Can you coordinate with the Lake County Health Department and see if we can get Dr. B to give a report after we have Dr. Frank and Karen's report? We can maybe go to the Lake County Health Officer.
I'll make sure we have them on.
Okay, it's she.
Her.
I'm sorry. Okay, I will make sure.
Okay, thank you. We'll make sure that happens. I appreciate it, Phil. Okay, anybody else out there that wants to give a report? Speak now, forever hold your peace. Councilman Rakos, you got anything?
Sure, I'll give just a little bit. We're still doing a combination. There was like 2 councilmen that were in the council chambers, and the rest of us were all Zoom. So we're very happy to hear that the governor's order has been extended. And I just want to let people know, as far as the testing is still available. Actually, I think it's almost to the rest of the year at the old Miller School Complex, 6530 New Hampshire, from 8 to 8, from Monday through Friday. And the hardest part about it is actually making sure that you register online. That's at lhi.com. If you go to that website, you got to register and give them all your information. But once you get that registration number for you, you can get tested. I've been tested there at least 3 times already. And it's very quick, and it's usually not the invasive test, although last time it seemed like they went a little bit further. But it's still available, and I encourage anybody that has any question to get tested. It's very easy to do.
Thanks, Councilman. Appreciate it. Councilwoman Katrina, you out there? Hi.
Hi, Mayor.
How you doing, Councilwoman?
I'm doing good.
You're always real good at every council meeting of updating us on the latest numbers with COVID, and you've been a big supporter of the COVID task force. So I was wondering if you had anything you wanted to report.
Actually not today, but I definitely will have something for the next meeting.
Okay.
So just continuing to make sure that everybody stay masked up. You know, that's extremely important, and understanding that while you're wearing your mask, you're helping to protect someone else, the same as they're wearing their mask, they're helping to protect you. Continue to social distance, wash your hands. As we are now saying, mask up, wash up, and back up. Stay away, so that we can continue to fight this fight together.
Thank you, Councilwoman. Nice talking to you.
Nice to talk to you.
Hey, anybody else before we wrap up? Okay, I just want to say thank you again for all the hard work from everybody on the task force. Our next task force meeting will be in 2 weeks, and hopefully we'll have a lot better news in 2 weeks about the number of people that are getting vaccinated, and maybe we'll get some answers on the new strain. I don't know if it'll happen by then, but you know, we'll resume in 2 weeks. I want to say thank you again to everybody that watches on Go Hammond TV and everybody that participates in the task force. I think it's very important. And again, to Lori, thank you very much for helping us out. Bye, everybody. Stay safe. Mask up.